Welcome to the Deep Dive. Today, we're exploring, well, the incredible complexity of the human body. We're focusing on a system that often works quietly in the background, your genitourinary system. It's one of those vital parts we don't really think much about, until maybe something feels a bit off.
That's absolutely right. And it's such an interconnected system. We're talking kidneys, bladder, ureters, urethra, and for men, the reproductive organs too. So our mission today is to shed some light on some common and sometimes quite surprising conditions affecting these parts. We want to cover what to look for, how they're understood, and importantly, what you can actually do about them.
Okay, great. Let's unpack the first one then. Benign prostatic hyperplasia, or BPH. So this is about an enlarged prostate, right? And the issue is it can actually block urine flow.
Exactly. As men age, some prostate enlargement is normal, but when it obstructs flow, that's BPH causing symptoms. And those symptoms are often the first clue. You might notice needing to go more often, especially waking up at night. That's nocturia.
That sounds disruptive.
It really can be. Or maybe hesitancy, like trouble starting the stream. A weaker flow, maybe it stops and starts. Abdominal straining sometimes. And that feeling of not quite emptying the bladder, leading to decreased volume or dribbling afterwards. These obstructive and irritative symptoms are really key signals.
Yeah, definitely sounds like something that impacts daily life. So, if someone's noticing these things, what's the usual process for figuring out if it's BPH?
Well, the basic evaluation starts with a really thorough medical history. Then there's a useful tool, the International Prostate Symptom Score, the IPSS. It's a questionnaire, basically. Helps gauge how severe those symptoms are. To get a clearer picture of the blockage, we might check the post-void residual urine, see how much is left after you try to empty your bladder. Or maybe uroflowmetry, measuring the urine flow rate. And a urinalysis is crucial too, just to rule out other things causing similar symptoms, like UTI perhaps, things that aren't BPH. Interestingly, routinely checking serum creatinine levels, that's a kidney function test, isn't usually recommended right at the start for BPH symptoms, unless there are other specific concerns.
Got it. So once BPH is confirmed, what are the main goals for managing it?
The goals are pretty clear, and they really focus on getting daily life back on track. We want to improve quality of life by easing those symptoms, directly improve urine flow by relieving that obstruction, and, prevent things from getting worse or causing complications down the line.
And if lifestyle changes alone aren't quite cutting it, what are the next steps, the more interventional options?
Right. If more intervention is needed, there's a range of surgical options. Some are minimally invasive, like transurethral microwave thermotherapy using heat or transurethral needle ablation, TUNA, which uses radiofrequency. Both try to shrink the prostate tissue. Then you have more standard procedures, like transurethral resection of the prostate TUR. That's where tissue is removed from inside the urethra. Or transurethral incision of the prostate, TUIP. There are also newer things like balloon urethroplasty, intraurethral stents, and sometimes, depending on the situation, open surgery or laser surgery might be considered. They all aim to open up that pathway and give relief.
Wow, quite a few options. But you mentioned lifestyle changes first. Just how effective can those be for BPH?
Oh, it can be surprisingly powerful, often the first thing to try. Simple habits can make a real difference, like urinate as soon as you feel the urge. Don't try to hold it in. But be mindful of fluids, too. Maybe avoid alcohol and caffeine, especially near bedtime. Drink smaller amounts spread through the day, but try to cut off fluids maybe 2 hours before sleep. And something people often don't realize, some over-the-counter cold and sinus meds can actually worsen BPH symptoms. So avoid those if you can. Regular exercise, reducing stress, that helps too. And importantly, if you see any signs of a urinary tract infection, a UTI, report that to your doctor right away, because UTIs can definitely complicate BPH.
Good tips. And for keeping track long term, you mentioned the annual digital rectal examinations and prostate-specific antigen, the PSA tests. Those are key for monitoring, right?
Absolutely. Key tools for ongoing prostate health monitoring.
Okay, let's shift gears now. From the prostate to something many people, dread, kidney stones, also called urinary calculi. I hear they can vary a lot in size.
They really can, from tiny, like a grain of sand, up to something quite large.
And the main problem is they can get stuck anywhere in the urinary tract, right? Making them incredibly painful.
Exactly. That intense pain usually happens when a stone blocks the flow of urine. If the stone's in the kidney, it's nephrolithiasis. If it's moved elsewhere in the tract, urolithiasis. Several things can contribute to them forming, like infections, urinary stasis where urine sits too long, even being immobile for long periods. The common types are made of calcium oxalate, calcium phosphate, uric acid, or struvite.
So what puts someone more at risk for getting these?
Well, dehydration is a huge one. Not drinking enough fluids means the chemicals that form stones get too concentrated in your urine.
Makes sense.
Other risks include UTIs, structural issues or blockages in the urinary tract, certain lifestyle things like obesity, diabetes, high blood pressure, and family history plays a role too. Interestingly, they're about 2 to 3 times more common in men and often show up between ages 30 and 50.
And the symptoms, I imagine they depend on where the stone actually is.
Very much so. Size and location are key. Generally, you might see blood in the urine hematuria, extreme back pain, often radiating around the side, maybe fast heart rate, high blood pressure, fever, chills, even nausea and vomiting. If a stone is just sitting quietly in the kidney's upper part, you might have few symptoms, maybe just a dull ache in the flank. But if a stone blocks the ureter, that tube from the kidney to the bladder, that's when you often get renal colic. Think of it like a spasm in the ureter trying to push the stone along. It causes severe wave-like pain, often with sweating, feeling pale. That sympathetic response.
Sounds awful.
It can be. And UTIs often go hand in hand with stones, which just adds to the misery.
Beyond the pain, what are the potential complications if a stone isn't dealt with?
Well, continued obstruction is a big one. That can lead to hydronephrosis, where urine backs up, causing swelling and pressure in the kidney, which can damage it over time. And like we said, recurrent UTIs are a common and serious issue.
So how do doctors figure out if it's a stone and pinpoint where it is?
Diagnosis usually starts with a urinalysis. That can show blood or signs of infection or chemical imbalances. Sometimes a 24-hour urine collection is done to see the overall composition. Checking the urine pH is helpful too. A low pH under 5.5 might point to uric acid stones, while a high pH over 7.0 could suggest struvite stones.
Okay.
We also check kidney function tests and blood levels of calcium, phosphorus, uric acid. But to actually see the stone and find its location, imaging is essential. A Cavity X-ray, maybe a renal ultrasound, or often a CT scan.
And during an acute attack with that level of pain, what's the immediate focus?
During an acute episode, analgesia pain management is absolutely critical. Getting that pain under control is priority number one. Hydration is also key, either drinking fluids or getting IV fluids to help flush the stone out. And antiantics for nausea and vomiting. For prevention later on, medications like thiazide diuretics or potassium citrate might be used. Allopurinol can help dissolve uric acid stones specifically.
And if the stone just won't pass or it's too big, what about surgical options?
Yeah, if it needs intervention, a common one is lithotripsy, specifically extracorporeal shock wave lithotripsy, ESWL. This uses focused sound waves from outside the body to break the stone into smaller bits that can then be passed. If you have ESWL, you'll almost certainly be asked to strain your urine afterwards for fragments.
Why is that important?
It confirms the treatment worked, and collecting those fragments lets us analyze what the stone is made of. That's vital information for preventing more stones in the future. Other procedures exist too, like uteroscopy, where a small scope goes up the ureter to grab or break up the stone. Or sometimes more invasive surgeries like pyelolithotomy or nephrolithotomy are needed for very large or complex stones.
So the key takeaway for managing stones seems to be pain management first, and then that very specific action. Strain all your urine to collect stones for analysis.
Exactly. That analysis guides prevention. And speaking of prevention, the single biggest thing you can do is increase fluid intake, aiming for 2 to 3 liters of non-sugar sweetened drinks daily. Proper hydration dilutes the urine, making it harder for stones to form. Then, based on the stone type, specific dietary advice and regular follow-up are really important.
Okay, let's move on to a condition present from birth, hypospadias. This is where the urethral opening isn't at the tip of the penis, but on the underside, the ventral surface, right?
That's correct. It's often picked up on prenatal ultrasound or noticed right after birth. Sometimes, though less directly related, assessments might find other associated things like feeding difficulties in babies, or later on maybe speech or hearing issues.
Is treatment always needed?
For very mild cases, maybe not. But often surgery is done. It's partly for cosmetic reasons, but also really important for ensuring normal urinary function, normal sexual function later in life, and, preventing potential psychological impacts.
Makes sense. And for parents whose baby has this, what kind of education or support is key?
Priority education for parents includes things like using special feeding nipples if needed, getting the baby ready for surgery, and really understanding the post-op care. That includes things like careful surgical site care, making sure the baby sleeps positioned correctly, maybe on their side, using suction bulbs if needed, plus monitoring things like daily weight and tracking fluid intake and output very carefully.
Okay. Next up is enuresis. Most people probably know this as bedwetting during sleep nocturnal enuresis. It's fairly common in kids, isn't it?
It is surprisingly common, especially in children 7 or older, and it does tend to be a bit more common in boys.
What causes it? Is it just delayed development?
That can be part of it, a maturational delay in bladder control. Sometimes it's related to incomplete toilet training or the body making too much urine at night. Difficulty waking up when the bladder is full is another big factor. Less commonly, other things like conditions that increase urine volume, constipation, or even structural issues in the urinary tract could play a role. If it happens during the day, diurnal enuresis, bladder irritability, and constipation are often the main culprits.
How do doctors figure out the cause, beyond just knowing the child wets the bed?
Well, it usually starts with a detailed history, understanding the patterns, any triggers, then a physical exam. Sometimes, especially if they suspect something like constipation is involved, more specialized tests like anorectal manometry might be done to rule out physical causes. They'll also look into mental health, cognitive function, history of toilet training, diet, really trying to get the full picture and make sure there isn't an underlying medical reason.
And what are the usual approaches to treatment?
Often starts with behavioral strategies, things like bladder training exercises to increase bladder capacity and control, and moisture alarms are quite effective. They go off as soon as wetting starts, helping the child learn to wake up to that sensation. Sometimes medication might be used short-term too.
Okay, our final deep dive today is on a really common one, urinary tract infections, or UTIs. This is a bacterial infection, usually starting in the urethra and bladder. That's cystitis?
That's right. Cystitis is the bladder infection. But it's really important to understand that if it's not treated or if it's severe, the infection can travel up the ureters to the kidneys. That leads to pyelonephritis, a much more serious kidney infection. The bacteria usually come from the perineal area around the anus, and UTIs are incredibly common. They're actually the second most common type of infection in children. And here's a really critical point, especially in hospitals. 10 to 15% of patients with urinary catheters end up developing a UTI. The most frequent bacterial culprit, E. coli.
Wow, 10–15% with catheters, that's significant. What else puts someone at higher risk for getting a UTI?
Several things. Basically, anything that interferes with normal urine flow or bladder emptying. So not being able to empty the bladder fully, any kind of obstruction, things causing urine to just sit there, urinary stasis. Also, decreased natural defenses, foreign objects like catheters or inflammation. UTIs are much more common in females, mainly due to anatomy. The shorter urethra just gives bacteria an easier path to the bladder.
Right.
Older adults, especially older women, are also at higher risk. Poor hygiene, bowel incontinence, certain sexual factors like using spermicides or diaphragms, or just general sexual activity can increase risk. And for men, as we discussed, BPH causing urinary retention is a major risk factor.
The symptoms can be tricky though, right? Especially in different age groups.
They really can vary. The classic signs are things like fever, dysuria that's painful or difficult urination, often a burning feeling and needing to urinate more frequently. But in babies or kids under 2, the symptoms can be really vague. Sometimes a fever with no obvious source is the only clue that prompts testing for a UTI. Other signs can include foul-smelling urine, pus in the urine, pyuria, or blood in the urine, hematuria. But here's the really crucial part, especially for older adults. Confusion, disorientation, sudden lethargy, or even becoming combative might be the only sign of a UTI.
Wow, just confusion.
Yes. It's so important because those symptoms mimic other serious things like pneumonia, stroke, delirium from other causes. A UTI has to be considered and ruled out. Children might show more typical signs like dysuria, maybe some bedwetting, nocturia, frequency, urgency, foul odor, and pyuria.
Given that range, especially the potential for confusion, what are the major complications if a UTI isn't caught or treated effectively?
Well, pyelonephritis, the kidney infection, is a major one. But even more serious is sepsis. That's when the infection gets into the bloodstream, causing a massive body-wide inflammatory response that can be life-threatening. Sepsis can even affect the brain, directly contributing to that confusion or acute delirium we mentioned. Other complications include kidney abscesses and, unfortunately, recurrent UTIs if the underlying issues aren't addressed.
So how is a UTI typically confirmed?
Diagnosis usually starts with a urinalysis. We look for cloudy, smelly urine, white blood cells indicating infection. And here's a key finding. Nitrites in the urine strongly suggest a kidney infection, or at least bacteria capable of causing one.
Nitrics, okay.
Those are produced by certain bacteria often involved in UTIs. Getting a proper sample is key. A clean catch urine sample is needed to avoid contamination. Then, a urine culture and sensitivity test is done. This identifies the specific bacteria and tells us which antibiotics will work best. Generally, a count over 10,000 organisms per milliliter confirms a UTI. And remember the golden rule. Always get the culture before starting antibiotics if possible. Oh, and a practical point. If a urine sample sits out at room temperature for about 2 hours, it needs to be thrown out and a new one collected. Bacteria can multiply quickly outside the body and give a false high reading.
Good to know. Beyond the antibiotics, what about non-drug ways to prevent UTIs in the first place?
Prevention is huge. Drinking adequate fluids is absolutely key. The usual recommendation is around 2,000 milliliters per day of water, maybe more for some people. Some evidence suggests cranberry juice or supplements might help by acidifying the urine, making it less friendly to bacteria. But definitely avoid things that can irritate the bladder, like lots of caffeine, alcohol, citrus juices. Good hygiene is important, obviously. Regular voiding, making sure you empty the bladder completely. And for anyone sexually active, voiding immediately after intercourse is a really simple, effective step to flush out potential bacteria.
Okay, so good hydration, avoiding irritants, avoiding habits. Anything else specific to avoid?
Yes, there are some definite no-nos for prevention, focused on keeping bacteria away from the urethra. So, no douching, no spermicidal contraceptives if recurrent UTIs are an issue, no perineal deodorants or sprays, no synthetic fabrics next to the skin, always recommend cotton underwear, and no bubble baths, as they can be irritating. Showers are generally better. And the absolute critical hygiene rule, especially for females, always wipe front to back, never back to front. This prevents transferring bacteria from the rectal area forward. For catheter-associated UTIs, prevention involves carefully considering if the catheter is truly necessary, using sterile technique for insertion, and meticulous daily care.
Makes sense. Now for treatment, you mentioned antibiotics, often starting broad spectrum, right? I know Bactrim, trimethoprim, sulfamethoxazole, that sulfa drug is often used.
Yes, Bactrim is very commonly the first choice if there's no allergy. If someone is allergic to sulfa drugs, then alternatives like macrobid or nitrofurantoin might be used. The absolute crucial message with antibiotics is, never stop taking them early, even if you feel better. You must complete the entire prescribed course to fully eradicate the infection and, importantly, to help prevent antibiotic resistance.
Right. Finishing the course is key. Any other advice with these meds?
If you're taking sulfonamides, like Bactrim, be aware of increased sunburn risk. Use sunscreen and drink plenty of water. This helps prevent urine crystals from forming, which can sometimes happen with these drugs if you get dehydrated.
Okay. And there's another medication sometimes used, phenazopyridine, often called pyridium. What does that do?
Pyridium. That's a urinary tract analgesic. It doesn't treat the infection itself, but it's specifically given for pain relief. It helps soothe that burning and irritation during urination while the antibiotics are working.
Does it have side effects?
The most noticeable thing is that it's absolutely normal for pyridium to turn urine and sometimes other body fluids a bright reddish-orange color, like fire engine red or orange. Patients need to know this is expected and harmless.
Good to warn people.
Definitely. However, any signs of liver problems, like yellowing of the skin or eyes, should be reported immediately, though that's rare. Also, patients should know it can stain underwear, clothing, even bedding, and might stain soft contact lenses, so wearing glasses might be better while taking it.
Got it. And finally, is surgery ever needed for UTIs?
It can be, but usually only for recurrent UTIs, where testing finds an underlying problem like stones, structural abnormalities, or strictures, narrowings, in the urinary tract. If there's a structural issue, something like a ureteroplasty surgical repair of the ureter might be done.
Well, we've certainly covered a lot today. We've gone through 5 quite different conditions impacting the genitourinary system, from BPH and those painful kidney stones to hypospadias from birth, childhood enuresis, and the very common UTI.
We have, and I think what this really highlights is just how intricately our bodies work and how changes, even seemingly small ones, can have a pretty big impact. Understanding these conditions isn't just about lifting symptoms. It's more about recognizing patterns, listening to your body's signals. Which maybe raises a question for everyone listening. What seemingly minor symptom might your body be trying to flag up? It's definitely worth paying attention to those signals.